Part 3. Digestion, eyes, mouth. The Demodex insecticide hypothesis. Most or all medications that are effective against any disease in humans, medications that reduce pain in humans, substances that humans become addicted to, and substances that humans are allergic to, contain at least one specific substance: insecticide/poison, acid/sulfur, hydrocarbons/petroleum-based pharmaceuticals, chloride/chlorine/salt, physical obstructions, zinc, calcium, dimethicone, PEG 3350, etc. That is obviously harmful to Demodex mites. The only exception are the new medications that cause the immune system to ignore the activity of Demodex mites without reducing the population as long as you continue to take them. Is there an obvious connection? Disease, medications, poisons, insecticides, Demodex mites, reduction in cancer. This video discusses the following questions. 6. Are Demodex mites the cause of digestive problems like chronic constipation and stomach cancer? 7. Are Demodex mites the cause of eye redness and itching, macular degeneration, TED, cataracts, etc.? 8. Are Demodex mites the cause of tooth decay, mouth ulcers, mouth and throat cancers? 6a. Are Demodex mites the cause of digestive problems like chronic constipation and stomach cancer? One indication of whether Demodex mites might be causing digestive problems would be if the treatments for stomach problems contain something harmful to Demodex. Bisacodal laxatives, Dulcolax/Duralax, Muxil, Fleet, Norilax, Alaphen, Erectol, and Carter's Little Pills, formerly Carter's Little Liver Pills, Amine. Bisacodal is a derivative of triphenylmethane. Triphenylmethane or triphenylmethane, sometimes also known as tritan, is the hydrocarbon with the formula C6H5 3CH. Senna laxatives, Senecot, Exlax, and others, Senaglycoside, also known as Senecide or Senna, is a medication used to treat constipation and empty the large intestine before surgery. 1. 5. The medication is taken orally, swallowed by mouth, via the rectum. 1. 6. It typically begins working in around 30 minutes when given by rectum and within 12 hours when given orally. 3. It is a weaker laxative than bisacodal and castor oil. 1. Senna derivatives are a type of stimulant laxative and are of the anthraquinone type. 1. While its mechanism of action is not entirely clear, Senna is thought to act by increasing fluid secretion within and contraction of the large intestine. 1. Senicides come from the group of plant Senna. 3. 11. It is sold under a number of brand names including Exlax and Senecot. 1. Senna occidentalis poisoning, an uncommon cause of liver failure. All parts of this plant are poisonous. Toxicity might be under-recognized due to the lack of awareness and absence of prescription information. A high index of suspicion in patients presenting with vomiting and diarrhea, followed by rapid evolution of liver failure, would be prudent. 6b. Are Demodex mites the cause of digestive problems like chronic constipation and stomach cancer? Continued. Castor oil. Wikipedia explains, the seeds of Ricinus communis are commonly crushed to extract castor oil. As ricin is not oil-soluble, little is found in the extracted castor oil. 9. The extracted oil is also heated to more than 80 degrees Celsius, 176 degrees Fahrenheit, to denature any ricin that may be present. First, I do not see any commonly sold cold-pressed castor oil that has been heated/refined Amazon castor oil. Secondly, when they say little, do they mean there may be some ricin in castor oil? I searched trace elements of ricin in castor oil and found this study, Toxicological Analysis of Ricin in Medicinal Castor Oil with Evaluation of Health Hazards. These chemists conducted this study to determine if medical-grade castor oil contained enough ricin to be a health hazard and concluded ricin cross-contamination in castor oil make it unsafe for medicinal and cosmetic use. That there was enough ricin in castor oil to be of concern. Traditional Ayurvedic and Siddha medicine considers castor oil the king of medicinals for curing arthritic diseases. It is regularly given to children to treat infections with parasitic worms. 37. Modern medical research suggests the purgative action induced by castor oil helps clear intestines of parasites. 38. Link. The toxin provides the castor oil plant with some degree of natural protection from insect pests such as aphids. Ricin has been investigated for its potential use as an insecticide. 25. Ricin has been used experimentally in medicine to kill cancer cells. Link. Potential therapeutic applications of plant toxin ricin in cancer. What castor oil packs are used for? Castor oil packs are used outside your body, with or without heat. The idea is that a castor oil pack is soaked with more oil than you can simply rub on your skin. This allows it to better absorb into your skin. Some people believe using the pack externally can also help with internal issues. However, little or no research supports the use of castor oil packs for internal conditions. 6C. Are Demodex mites the cause of digestive problems like chronic constipation and stomach cancer? Continued. Constipation. People sometimes take castor oil by mouth as a laxative. In this way, castor oil is used to help bowel movements and empty the stomach. Using external castor oil packs may also help treat constipation. I don't believe there is any clear explanation why a rag with castor oil on it placed on the stomach might reduce constipation. In Demodex world, the explanation becomes obvious. Castor oil containing traces of ricin placed over the solar plexus harms Demodex mites on the surface of the skin and possibility below, reducing their activity in that area, which reduces stomach muscle restrictions. I found that a boil filled with fluid exists all the time directly over my solar plexus, and that it can almost completely stop bowel movement when aggravated with strong internal treatments. Pepto-Bismol, bismuth subsalicylate, 525 milligrams per 15 milliliters. Bismuth subsalicylate. An overview, Science Direct Topics, 0 bismuth subsalicylate is defined as a metallo drug that is synthesized from bismuth oxide and salicylic acid, commonly marketed as Pepto-Bismol, and is notable for its rapid and efficient synthesis using ion and liquid-assisted grinding techniques. Synonyms. Other names for bismuth subsalicylate include basic bismuth salicylate and salicylic acid basic bismuth salt. Salicylic acid, knowledge and references, Taylor and Francis, as stated previously, salicylic acid, or as a precursor to the acid, sodium salicylate is produced commercially by treating sodium phenate, the sodium salt of phenol. Phenol is a well-known petrochemical starting material, with carbon dioxide at high pressure, 1,500 psi, and high temperature, 117 degrees Celsius, 242 degrees Fahrenheit. 6D. Are Demodex mites the cause of digestive problems like chronic constipation and stomach cancer? Continued. Can Demodex mites survive inside the body, inside the mouth, in the stomach, and intestines? Diarrhea and acroid mites. Clinical study. In this study, Acaricero, Tyrophagus putrescentia, Dermatophagoides farini, B. Terranicinus, Lysipphagus domesticus, G. ornatus, Harpoglyphus lactis, and Tarsinemus granaries were separated from stool of patients with diarrhea. This confirmed that acroid mites were able to parasitize in human intestines, which might play an important role in diarrhea. Like other intestinal parasites, the mites living in intestinal tract may stimulate mechanically and damage intestinal tissues with its Gnathosoma, Polycera, and feet, 17 to 25. Certainly, they may also intrude into mucus and deep tissues and cause inflammation and necrosis. Demodex infestation of oral mucosal sebaceous glands. Abstract. An unusual case of oral infestation with the hair mite Demodex was presented. Parasites were observed in enlarged ectopic sebaceous glands following biopsy. From a review of the literature, it would appear that oral involvement has not been reported previously. Demodex can live in the mouth and does not require a hair follicle. Other mites in food have apparently been able to pass through the stomach and live inside humans. Gastric mucosa, lining of the stomach, consisting of an inner epithelium, a middle lamina propria, and an outer muscularis mucosae. The surface cells produce mucus that protects the stomach from attack by digestive acid and enzymes. Bacteria are able to live directly inside due to the gastric mucosa, so can Demodex and other parasites survive directly in the stomach for this reason. Pass through the stomach alive? Survival in hostile territory, the microbiota of the stomach. Question 6. Can Demodex mites live in the entire digestive system? And are they the cause of digestive problems as indicated by the fact that most or all treatments for digestive problems contain something harmful to Demodex? 7a. Are Demodex mites the cause of eye redness and itching, macular degeneration, TED, cataracts, etc.? Multiple types of eye drops were tested to reduce redness in the eyes with very little reduction in redness. But one eye drop did almost completely reduce the redness in a few minutes. Lumify eye drops, which contain brimonidine tartrate, eliminated redness in the eyes in a few minutes, lasted for several hours, and was far superior to anything else tested. According to the Demodex insecticide hypothesis, if this medication is very effective at reducing redness and itching in the eye, it must contain at least one ingredient that obviously kills Demodex mites. According to the Demodex disease hypothesis, Demodex mites must be causing the redness and itching because Demodex is the cause of most or all disease. The ingredient that obviously kills mites will normally be the most active ingredient. The most active ingredient in Lumify is brimonidine tartrate, 0.025%. The search stating, "Is brimonidine tartrate an insecticide?" first yields the article "Adrenoceptor agonist poisoning after accidental oral ingestion of brimonidine eye drops," which states, "Conclusions. This case illustrates the ability of brimonidine to gain rapid access to the central nervous system. This first passage is followed by a redistribution phase with rising plasma concentrations. Children who accidentally ingest brimonidine orally should be admitted to a pediatric intensive care unit." So it is a type of poison, and the hypothesis states insecticide/poison, because in many cases what is poison to insects is poison to humans, and the reverse. A search stating, "Is brimonidine tartrate poison?" down a few items yields the article "Brimonidine tartrate" by go.drugbank.com. It states, ophthalmically, brimonidine is used to lower intraocular pressure by reducing aqueous humor production and increasing uveoscleral outflow. The topical form of brimonidine was approved by the FDA in August 2013 for the symptomatic treatment of persistent facial erythema of rosacea in adults. 7b. Are Demodex mites the cause of eye redness and itching, macular degeneration, TED, cataracts, etc.? Con. It is marketed under the brand name Mervaso .13 brimonidine. Is the first topical treatment approved for facial erythema of rosacea .8. This article states brimonidine tartrate was previously used to treat rosacea. Now we know it is a poison that can harm humans and was previously used to treat rosacea. There was no indication stated that brimonidine tartrate treated rosacea by killing Demodex mites. The role of topical brimonidine tartrate gel as a novel therapeutic option for persistent facial erythema associated with rosacea. Brimonidine tartrate topical gel is the first approved agent for the treatment of facial erythema associated with rosacea and acts through vasoconstriction of small caliber subcutaneous blood vessels via specific agonism of the postsynaptic alpha-2 adrenergic receptor on endothelial cells. Ivermectin, the medication that replaced brimonidine tartrate, is one of the strongest medications prescribed to specifically kill parasites in humans. It is specifically prescribed to kill Demodex mites anywhere on and inside the human body. Now we know brimonidine tartrate is poison. It was previously used to treat rosacea. The medication that replaced it is the prescription medication Cilantro that contains the insecticide ivermectin specifically to kill Demodex mites on the face. Demodex blepharitis is a chronic inflammatory disease caused by Demodex infestation, affecting the lid margin and ocular surface, which can lead to serious eye problems. 1. The typical symptoms include eye itching, burning, dryness, irritation, watering, blurry vision, or the sensation of heavy eyelids. Association between Demodex infestation and ocular surface microbiota in patients with Demodex blepharitis. Symptoms: red eye. Causes: allergies, blepharitis, which is eyelid inflammation, Malaysian or stye, which comes from inflammation in the glands of your eyelid. Complication from a recent eye surgery, contact lens complication, corneal abrasion, scratch. First aid: corneal herpetic infection or herpes, corneal ulcer, dry eyes, caused by decreased production of tears. 7c. Are Demodex mites the cause of eye redness and itching, macular degeneration, TED, cataracts, etc.? Continued. Symptoms: red eye by Mayo Clinic staff. Demodex mites are known to be the cause of blepharitis in some cases, and blepharitis is listed as the second cause of redness in the eyes by Mayo Clinic. Note: possible relationship between allergies, which is the first cause, and Demodex listed, is discussed under the allergies heading. Questions 7a. Is it possible that the reason brimonidine tartrate in Lumify eye drops is so effective at reducing redness in the eye is that it is a poison, and that Demodex mites are causing the redness in the human eye, and it is harming them? B. Since it is a well-known fact that Demodex mites are causing many types of problems all around the outside of the eyes, is it possible that if redness in the eyeball is caused by Demodex mites, that they are living on and under the surface of the eyeball, and even around and behind the eyeball, and that Demodex mites could be causing all external and internal eye disease, redness, itching, macular degeneration, TED, cataracts? C. If many serious eye diseases are caused by Demodex mites, and many doctors believe ivermectin taken internally in 1 or 2 doses kills almost all Demodex mites inside the body, then why aren't the doctors giving patients ivermectin to kill them, especially considering as many as 95% stay below the surface at all times? Note: it is unclear even if brimonidine tartrate is killing or inhibiting the movement of Demodex mites, if this would reduce the redness within a few minutes. It may be possible this medication could lower intraocular pressure and harm Demodex, but there is an obvious possible connection between Demodex mites and brimonidine tartrate through rosacea. Testing brimonidine tartrate directly on Demodex mites might help to prove or disprove this. When brimonidine tartrate wears off, I would feel some itching, which some other reviews reported also. Anytime I have taken any strong internal treatment for Demodex mites, it increases itching all over my body from my toes to the top of head, and always in my eyes. It was the reactions from cilantro, ivermectin, that caused serious itching in the eyes and eyebrows. 8. Tooth decay, mouth ulcers, mouth and throat cancers. When I went to the dentist recently, I was given a toothpaste with a prescription dosage of 1.1% sodium fluoride. When returned home, I searched, is fluoride an insecticide? And this article came up, fluorine-containing insecticides. Abstract. Fluorine has played a significant role in insect control since about 1896, when sodium fluoride and various iron fluorides were patented in England as insecticides. Sodium fluoride was used in the United States for cockroach control before 1900 and was introduced in 1915 for the control of poultry lice. However, the use of fluorine insecticides did not become general until the 1930s, when the disadvantages of arsenical residues on food crops became apparent and the inorganic fluorine compounds were introduced as safer substitutes. When I searched, I found that sodium fluoride was originally invented as a strong insecticide and is so strong it is banned in Europe. European countries banning the use of fluoride. Fluoride is said to reduce the negative effect of acid on teeth. Fluoride prevents tooth decay by making the enamel more resistant to the action of acids. They accelerate the buildup of healthy minerals in the enamel, further slowing the occurrence of decay. Studies even show that in some cases, fluoride can stop already started teeth decay. Impact of fluoride on dental health quality. As mentioned above, Demodex mites have been found living in the mouth. Demodex infestation of oral mucosal sebaceous glands. I have also found in the past that whenever I consumed 3 lifesavers within less than 1 hour, I would get mouth ulcers and considerable stomach pain. Now that I have developed a tolerance to citric acid, I no longer get mouth ulcers, even consuming 1 gram of citric acid every hour for 8 hours consecutively. Question 8. If fluoride is believed to decrease cavities in the mouth, and it is known to kill insects, and Demodex mites have been found living in the mouth, could fluoride be killing Demodex mites, and they are causing cavities?